my name is Sharn, and I'm a second-year occupational therapy student at the University of Pacific. And I wanted to talk to you about how occupational therapy can play a vital and valuable role in your community clinic. And so one of my favorite parts about occupational therapy is how it uses a client-centered and holistic approach, meaning that we look at the person as a whole rather than just looking at their diagnosis or their single skill deficit. And so when we do this, we focus on individual strengths and we use those strengths to reduce the barriers that are interfering with their participation or independence in their everyday life. An example I want to give you is if in your community clinic, you may work with an adult who is consistently missing appointments or struggling to follow through with the recommendations. Rather than viewing this as a non-compliance, an occupational therapist could look at the factors that are affecting this, such as transportation challenges, maybe it's fatigue, maybe cognitive load is too much, and so anxiety is heightened, and how just like maybe the clinic's routine fits into the client's daily schedule might be a barrier as well. And so OTs can help the team identify practical solutions such as simplifying schedules, adjusting routines and expectations, even modifying how the information is presented to just improve that engagement and that follow through for that client. Another example I want to give you, so it can be a little bit more relevant to you, is if an adult client comes in who has physical ability to complete the task, but continues to struggle with daily activities like managing medications, returning to work, returning to household responsibilities. And so occupational therapy just looks beyond that physical capacity to assess executive functioning, maybe it's environmental setups or habits, and looking at their routines, and just consult with staff to recommend strategies such as simplification, environmental modifications, or adaptive approaches that align with the client's strengths and their lifestyle. And so by taking this strengths-based approach, occupational therapists help remove those barriers in a way that is more realistic and sustainable, as well as relevant and meaningful to the client. And so this not only supports improved outcomes, but also enhances interdisciplinary care as well, which would be very beneficial at your community clinic. And so when occupational therapy is included into a consultative role, teams gain a clearer understanding of why clients may struggle and how small targeted changes can lead to meaningful improvements in their participation